Hi everyone, welcome to today's webinar. My name is Arielle Chaville, a solutions specialist here at Ultralink. I work closely with Brian Cottle, a current professor of healthcare administration, who leveraged his experience in healthcare management and cardiovascular services to put together a quick rundown for you today on how you can expand your reach with cloud-based image management. We'll talk about how you can effectively manage the exam lifecycle across multiple remote sites, seamlessly onboard new locations, drive accessibility across the clinical care team. First, we'll dive into what's cloud-based image management. We'll talk about how it works, how it can simplify your workflow, and some capabilities network-wide. Cloud-based image management works by sending all related exam information, including clips, stills, patient demographic information, measurements, notes, anything else, which can then be sent over to all authorized users. They can then review that information no matter where they are in the world, as long as they have an internet connection. With auto-populating review worksheets, you can then complete the report, which can then be distributed, sent over to an EMR EHR, sent it by fax, PDF, whatever it may be, and then of course go back to our website to look it over at any point in time later. This can tie together an entire workflow for multiple locations. You can upload from any office. Clinicians can review no matter where they are, whether they're at the office, at home, on the go, and then an administrator can easily manage and distribute those exams from all locations from anywhere. This can help you advance your network of care by connecting multiple sites to multiple important stakeholders. People like your physicians, your hospitals you're clinically affiliated with, your payers, and your patients. You can use this for QA, connect with partners, other experts, for telemedicine purposes, and for audits. Now we'll dive into how a practice can apply these principles. One example of how cloud-based image management can help you expand your reach in rural communities is one of our clients in Utah. They started to see some demand for their reading services in their local area. Because they were able to onboard their new sites and turn around their reports so quickly, word of their professional services spread. And they now not only have multiple locations in Utah that they service, they also work with groups in Wyoming and Nevada. And in your instance, with a cloud-based infrastructure, it's easy for practices to drive connectivity across remote sites. So this can be something like your rural hospital, internal medicine group, tertiary care center, a regional medical center, all can be under one umbrella. If you ever find that another practice needs your reading services, our client services team handles all remote training and install, so you can get your new site up and running in no time. And now you're wondering, oh, how can I manage this growth effectively? So we'll cover those pieces now. Streamlining your exam lifecycle is easy. Workflow rules will enable you to automatically route the right exams from the right location to the right health provider. For example, if you want all of your echoes from a particular location to go to Dr. Smith, you can have it set up so every an echo exam is uploaded from that site, it's automatically sent over, and then routed back to the referring doctor. As you expand your reach and begin adding exam volume from multiple remote sites, it's going to become even more important to effectively manage that volume. The automated administrator reporting all the data is in front of you, and you can ensure that the exam lifecycle is streamlined. You'll be able to monitor your turnaround time, identify opportunities for growth, such as by adding on new modalities, maybe buying a new ultrasound machine. You'll also be able to QA areas of improvement. You can schedule overreads or have quarterly reviews. That way, you can continue to grow and offer your professional services to more remote areas as you go on. And then you might wonder, how does this empower us to provide quality patient care? With cloud-based image management, you can add unlimited users. One way to effectively deploy this is by closing the loop on the entire care team. The internal medicine or GP, who will be referring the patient, your cardiology team, they'll be reporting on the exams, and should there be any need for a surgery, procedure, it's very easy to keep track of any follow-ups to make sure everyone's kept in the loop. We've also seen many of our clients that employ cloud-based image management to manage remote sites, they've seen an uptick in surgeries performed at their location. One huge benefit, naturally, of cloud-based image management is that it completely eliminates any barriers of distance. No matter how remote a patient community is, they can still receive the same quality healthcare that your team provides by having a platform that connects their local healthcare providers to you for community-based collaboration. We'll quickly wrap things up. I just want to thank Brian Cottle for generously sharing his time and over 10 years of healthcare management cardiovascular service experience with us today. Incredibly helpful. And I also want to thank you, the audience, for listening. If you have any questions at all, or you're just curious about cloud-based image management and how it can help you, feel free to check us out at ultralink.com. You can shoot us a note at sales@ultralink, or you can give us a call below. We'll be happy to chat with you about any questions you may have. We look forward to hearing from you. Have a great day. One huge benefit, naturally, of cloud-based image management is that it completely eliminates any barriers of distance. No matter how remote a patient community is, they can still receive the same quality healthcare that your team provides